Good morning. This is Dr. Timothy Scott Beck at LifePoint Medical, giving you your daily update on what's going on around here. We're actually doing great this morning, and we've been busy, and that's a good thing. And so you just let us know if you need any help, okay? We've already treated numerous people this morning for COVID. This thing is all over this place now, and it's the highest levels. The infection rate jumps every single day, significantly, like 30 points. It's jumped 30 every day for the last 2 or 3 days. So the only thing that's become abundantly clear about this new strain is, number one, it's not near as bad as the others. However, I do still think, unfortunately, that it at times may it's hitting some people, because I know there's some people that are very sick right now because of COVID. Or at least I'm hearing people talk about it. So anyway, it doesn't look like the vaccines are that well. I'm not sure there's any mediating factors except for complete isolation to keep from getting this variant, and I don't recommend that either, not at least for not a long period of time. So I do think that the vaccinated people are maybe a little bit better off, and decrease their risk of dying from this thing. However, I certainly don't think it keeps you from getting the disease or spreading it. So just hang in there and keep using that rubbing alcohol and the mask. I know they come out needing N95 masks. Are really recommending those now. I will tell you, I've been fitted for N95 mask several times because I had to when I worked in certain situations in the hospital. And I guess the first thing I'd have to do is shave my beard to be compliant with N95. So you can't have any facial hair with N95, and they have to seal it around your face. And the problem with the N95 mask is you can't wear them that long. I mean, they really are uncomfortable to wear, and they're in relatively short supply, but it looks like they're trying to fix the supply chain. So anyway, hang in there on the COVID. We got you if you need to. We're treating people and helping them as much as we can. Let's talk about, okay, so lots of people have osteoarthritis, okay? The osteoarthritis is the arthritis you get from living long. I call it a sign of wisdom, because if you live long enough, okay, and you do enough in your life, you're going to have joint pain. I mean, your joints are going to get wore down a little bit, okay? And so, if you got 100,000 miles on those feet, you're going to have some joint pain. If you're having joint pain, a lot of people get joint replacements and stuff like that, but there's a subset of group of people who just need a little repair done on their knee joints or their different joints. And that's why I've done a lot of research and actually offer the platelet-rich plasma treatment at this time. And what that is I have you come in, and we draw your blood and we spin it down and we pull out a very specific repair layer, the layer that does all the work, because it layers out when I put it in a machine, a centrifuge to get it. And I pull those out, and that's what I inject into the joint or whatever, and it appears to give people long-term relief from joint pain. It does a little bit of repair work. We don't know what all it does, okay, but we do know that it does give people relief. And I've done it on different things for different types of pain. And, pain after a fracture, it seems to work really good with that. Just regular old osteoarthritis in your knees and your shoulders can be effective in decreasing your need for pain or pain medicine, or maybe even surgery. And certainly if you're not a candidate for surgery and you're having severe knee pain, this would be worth doing. So what do? I charge $500 to do the extraction and run it through the machine, but there's enough product out of that to do 2 different joints. So really you're getting a joint, $250 per joint, which is very, very reasonable compared to what some places are doing with this treatment. So it's $500, and we got enough product for 2 joints after we draw your blood and we process it appropriately. So if you're interested in that, if you fit the bill of somebody who's got joint pain who wants to try longer term relief, or we give you steroid injections and you get relief from those, but you need them too often, those are other people that we might be considering for platelet-rich plasma. So if you're interested in that, please ask us about it while you're here in the office, and it is something we do, and if it's right for you, we'll try to provide it for you. Otherwise, thank you for listening to me. You have a great day, and please call us if you